First, let's examine how the palate can cause or contribute to snoring and sleep apnea. As throat muscles relax during sleep, unsupported or excess tissues, like the soft palate, collapse, reducing the cross-sectional area of the airway. For a constant volume of inspired air, the airspeed through the collapsed region must increase. This creates an imbalance of forces in the airway, which can set the palate in motion. The palate vibrates as the aerodynamic forces overwhelm the structural integrity of the palate. And when the negative pressure in the airway reaches a critical point, the combination of collapsible tissues and loss of muscle tone results in airway collapse or obstruction.